Now let's say one other thing. If we talk to our patients who are watching the video today, or you see this, sometimes you may have heard our patients say, or sometimes I've seen it on the board, I don't know, Dr. Rutledge, the surgery's not working in me because I still have cravings.
Yeah, I've read that before too.
Think estrogen patch, okay? Because our surgery is so powerfully effective, we see it always work, that in those people who say, I'm having a craving, I'm really not getting the effect of the surgery, when we have had patients like that, we put on an estrogen patch, they feel better.
I'm still because I'm going to continue to be on the pill because I used to have really bad cramps and, so I'm not just on it for the safe sex portion of it. I'm on it because I did better on the pill. So can I wear a patch and take the pill?
Yeah, let's talk about that for a second. Whatever dose of birth control pill you were taking before is probably the wrong dose for the new you.
Okay.
Okay? The amount of estrogen a heavy woman needs to have the appropriate estrogenic effect is 3 or 4 times higher than a thin person.
Okay.
Because an obese woman is relatively estrogen resistant. In the worst case, that patient constantly secretes higher and higher doses of estrogen. The ovaries are stimulated to produce that estrogen because they're estrogen resistant in the peripheral cells, and the body of the heavy woman is demanding more estrogen so they can get the effect of estrogen. As it pumps out more estrogen, there's a side effect of some extra weight gain, some hypertrophy in breast and hip and other parts of the body tissue. And so you get a vicious cycle. Most of our obese patients have elevated estrogen.
Yeah.
Okay, high estrogen. They have high estrogen because their peripheral cells have sent a message to the pituitary saying, I need more estrogen because I'm not getting the estrogen effect I need out here. Now, let me explain that has changed in you as of yesterday.
Okay.
Your estrogen levels are going to be plummeting and your estrogen sensitivity is going to be going up.
Okay.
Overall, that means that your total body exposure to estrogen over the coming 10, 20, or 30 years is going to plummet. Along with that go 2 major benefits: a decreased risk of breast and endometrial cancer, a decreased risk of blood clots.
Yeah.
All right. Now, let's go back to your birth control pills. Okay. First of all, you may not need them anymore because you're going to be a new you.
Okay.
If you do need any kind of estrogen or progesterone support, you're probably going to need a totally new and different dose.
Okay, I'll just talk to my general doctor about that.
In addition, the estrogen patch has been studied in comparison to various pills for some of the symptoms of estrogen.
Okay.
By that I mean depression, irritability, anxiety, cramps, and things like that. In a study from Harvard, they looked at 4 groups of women with depression. They gave one group sugar pills or placebo. They gave one group Prozac. They gave one group a tablet of estrogen, and they gave one group an estrogen patch. The Prozac and the estrogen patch worked very well. 70 to 80% of depression was resolved. The placebo and the tablet of estrogen worked in about 20 or 30% of patients. Excuse me. So what we recommend, whatever you think was right for the old you is probably not going to be right estrogen-wise for the new you, because you're going to be transformed. We expect that, like the cliche says, today is the first day of the rest of your life. So what you need to do is be alert and be aware, probably drop the birth control pills, and then keep that estrogen patch available and use it as needed.
Okay, is it okay to stop if I've already taken a week of my pills, if I just would stop?
Yeah.
Or should I just finish the month?
No, stop them.
Okay. And I gotta know when my periods are now, because I used to know like clockwork on the pill. Okay.
Other questions?
These questions are really open.
Sorry, man.
These
Not
questions.
helping you. Did you say you staple and sew the stomach belly, or you both?
If you look on the videos, you can actually watch us do this. Well, but you can.
Yeah, I said I watched
Well, but
all of them.
Well, but now you'll be able to if you want to go
lost my
back.
nerve to get the surgery.
Well, but I mean, if you want those kind of technical questions, you can actually see it happen. But the short answer is that once we have created a new stomach, we've cut and created this new, thin, narrow pouch with a dead end. Now we have the bowel running from top to bottom, and we go downstream 6 feet, and we put a hole with our little instruments in both of those. We put them together and fire a staple gun to hook them together. Then we put stitches, staples, and then sew one more time.
Okay, of course, my biggest fear is, oh no, it's gonna bust open and I'm gonna be
Yeah,
bad.
it's really
You know?
good. I mean,
It could bust open. That is one of our risks that
I
we
didn't want you to say
fear.
that.
Well, it could happen. We are blessed in that that's an extremely rare complication, and our leak rate is well under 1%.
so that is what leak essentially means is it splits open.
Right, it
You die
pops.
from that if you get a leak?
You may, of
Yeah.
course. It's a potential. It's just like a perforated appendix. So.
Well, we had my sister's teaching mate, 4th grade, went and got the Maroon wine in Mexico, and got back to Grand Island, and it had a leak, and before they caught it at Creighton, they took her to Creighton. She had infection really bad. Well, then at Creighton, of course, then they revised her, but she was in the hospital like for 4 months, and 2 days after her last surgery, she died of a blood clot. And I assume because she'd just been in the hospital
bed for so long.
in bed for so long.
So how long are you at risk for that?
That's 7 days.
So
That's why
after
we
7
keep
days, it's all healed together, kind of.
Right, just like your skin. Think of the skin incisions as a canary in the coal mine. So when you look down at those skin incisions, they're healing over the next 7 days, just like the wounds inside of you. They're being replaced by collagen. That's the tough tissue that is used to form scar to heal areas that are cut. And so the areas that are sewn and stitched and stapled are going to be replaced by your own collagen at the exact same rate as what's happening on your skin on the outside.
These staples don't dissolve or anything, they just stay there?
There's titanium staples. They are about the size of a sesame seed. And again, if you watch on TV, you can see them. And those staples get buried within the scar tissue forever.
So not floating around in your body somewhere then.
Not unless you dropped one.
Actually, we've had some people where they've actually come out through their abdominal and they go, "What are these tiny little staples?" And they said, "Did I need that one?" No problem.
My husband had a piece of glass in his hand on an accident. 20 years later, we went on this detox diet, and while we're on it, it popped right out of his skin when it came.
Right. Okay, well, we'll let you guys go back upstairs. Jennifer, you want to escort them back upstairs?
Thank you.
You did great.
No worries.
See you later.
Good luck.
All right.
Glad you all were doing so well.
Thank you so
Oh, yeah.
All right,
much.
congratulations.